So welcome everybody. I'm delighted to be here. My name's Kevin Rennie. I'm the Chief Operations Officer here at NHS Providers. I'm delighted to be welcoming and hosting the session for NHS Supply Chain. We're going to be talking about resilience and quality during the pandemic and building a future looking forwards as well. I'm not going to talk much. I'm going to bookend this session. I'm going to hand over very quickly to my colleagues at NHS Supply Chain, and I'll come back at the end of their content with a couple of polls, and then we'll move to the questions. If you've got questions as we go through, please do use the Q&A function, and we'll be using that in this session. So look forward to handling your questions at the end. I'm going to hand it straight over to the rest of the panel, and I think Sarah's going to kick us off.
Brilliant. Thank you, Kevin. Thank you for that. So good afternoon, everybody. My name's Sara Ford. I'm the Director of Strategy, Comms and Marketing for NHS Supply Chain. I'm delighted to be here this afternoon. Hope you're enjoying the conference. And I'm joined today with three colleagues, Chris Holmes, the Director of Supply Chain, Adam Blake, who's one of our regional directors, and we're very delighted that David Main, who is the Director of Procurement for Southwest London Procurement Partnership, is also with us and will give a perspective from the Trust on some of the things we've been doing. So if I just get straight on into the story we wanted to talk you through. So today we wanted to talk a little bit about how the pandemic has been affecting the purchasing and supply of medical products, and hearing obviously firsthand from David about how his trust and their region has been working on structure and governance arrangements and the changes they've made to actually help meet some of the change demand throughout the pandemic. We'll see the impact that change has had at a national level, and how NHS Supply Chain has been working as part of the NHS to support the system and make sure that procurement and supply chain has continued to flow products to the front line. So for those who don't know much about NHS Supply Chain, just a couple of facts and figures. We are a part of the NHS. We've existed for many years now, and our remit, I guess, is to leverage the NHS purchasing power and drive savings to the front line. However, it's much more than that. We are very focused on making sure that the products we supply are clinically assured, fit for purpose, that we deliver with very high levels of service in ward-ready roll cages for you all, and that we do that in a way that's sustainable for the future. We existed in our current form since 2018, so we're a wholly owned subsidiary of the Secretary of State for Health. And obviously the work we do, procurement and clinicians, our objectives are very much focused also on delivering good patient outcomes and patient safety, to make sure that actually working with clinical colleagues, we're able to drive those things as well as we do with our savings. Just a couple of stats for those who are numerically minded. We provide about 4.5 million orders per year across 94,000 order points for the NHS. As I've said, we deliver to wards. We have 7 distribution centres and deliver to just under 17,500 locations. Our catalogue has over 400,000 products in it, and continues to ebb and flow. So a fairly large organisation. So just turning now to the example that we were going to talk through. So in common with many of your organisations, we have obviously experienced unprecedented challenges over the last year or so, and we've learned a lot, and we continue to grow stronger as a result of that. From a governance perspective, obviously we've had to find new ways of operating to deliver what was needed, faced with the immediate priorities in front of us. With our board, we work closely to make sure that decisions were cutting through processes and being made in an expedient way, that we were balancing the financial concerns of the organisation with the immediate demand, and first and foremost, recognising that patient need was really the primary driver of everything we were doing. The balancing of sourcing at pace and scale was also weighed up against the need to ensure only high quality products reach the front line of the NHS. So like yourselves, there's been a lot of balancing and calibration to be done. So today we just wanted to take an example, and we wanted to use ICU consumables and think through or explain to you the different perspectives of how that's evolved through COVID, to show that we've been focusing on quality, but that we've been developing greater organisational agility to make sure that we've been able to sustain a resilient supply chain of ICU consumables throughout the pandemic. We're also going to touch a little bit on the end of the presentation in terms of the plans for the future and how we're baking some of those changes into what we do. So I'd like to get started by introducing David Main, Director of Procurement at Southwest London Procurement Partnerships, and he's going to explain a little bit about how working collaboratively and establishing new governance arrangements has enabled himself and his colleagues to manage COVID demands in his area. Over to you, David. Thank you.
Thank you, Sarah. So, and thank you for the opportunity to speak. I'll start at the end, which is where we are now. So on the 1st of April this year, the Southwestern Procurement Partnership went live. It's a merge of all the procurement teams in South West London to the 4 Acute trusts, so Kingston, Croydon, Epsom, St Helens, and George's. It is a year later than expected, and certainly a year later than planned. However, if anything, the events of the last year have actually managed to accelerate both the acceptance of the organisational change and also the expectation and the view of what procurement is and what it can offer, rather than the way it was viewed previously. If we can go to the next slide, please. So, taking us back sort of 12 to 18 months, in South West London, there's the Acute Provider Collaborative, which is the 4 trusts previously mentioned. And the main aim was to deliver everything around delivering patient care, excellent patient care across South West London. This covers a lot of areas. It's not just things like procurement and back office functions. It's around patient pathways. It's different clinical areas and how they operate, but also how the corporate back office functions can actually underpin and help deliver the aims of the APC under the simple, smart, sustainable. So not only was it around reducing unwarranted variation, aggregating demand for goods and services, standardising where we could, but actually it's about ensuring financial sustainability, using the right tools, using the right partners, whether it be LPP, SCCL and other colleagues, to ensure the right quality of goods and services were delivered where they were needed by clinical colleagues. We can go to the next slide, please. So the new structure proposed was approved back in January 2020, which seems like years and years ago now, but it isn't that long ago. Actually addressed the aim. So we had a single view of categories across South West London. We had a single view of clinical need. We would look at categories once across South West London rather than looking at the same category in a single trust, but doing it 4 times. It's about engaging with our clinicians to make sure that we had the right clinical engagement across everyone, to look at why individual trusts did things differently, some for good reasons, some just because it's the way they'd always done it. And that tied into the aims of SCCL in terms of looking at the local, regional and national approach to procurement. Central spend data, implementing an inventory management system across all 4 trusts, having common catalogues. Scan for safety in theatres, which is about to go live in the next couple of months. The model was to be supported by a similar engagement model as well with our colleagues from the NHS Supply Chain and SCCL, with a regional ICS support model rather than the individual trust account management that was there previously. There was a move to focus on commercial and contract management, engaging with our suppliers, engaging with the market, actually having the conversations about what was available, what problems and risks might be occurring, and to make it a more customer service focused organisation rather than the transactional element that used to be there. And obviously the supply chain and materials management side, getting the goods and services to the right quality that we order to where clinicians need them to be able to provide the best patient care for our patients. If we can go to the next slide, please. In addition to the structural change, we actually realised that there needed to be a full cultural change for this. Procurement had always been seen as a transactional place that you went to get something. It was somewhere they told you no. It was a SIP delivery function that people only ever went there to provide CIP to get some money off. If they bought it for £1 last year, they would like it for 90p this year. It's very reactive. There was a lack of collaboration. There was a lack of leadership across South West London. That's not to say the teams didn't deliver and help our colleagues, but in order to really deliver the full benefits, not just the CRP benefits of people to raise POs and fix problems, there needed to be a really big cultural change of how we moved forwards. If we can move to the next slide, please. The new model, as is shown in this diagram, we did a workshop across South West London with all of our teams, our stakeholders, to look at actually what we wanted to be as a procurement function. And as you can see from this graph, strategically orientated, collaborative, actually engaging. What do our clinicians want? Rather than what they already bought and can we buy it for cheaper, are there different models of delivery? Investing in our people, taking risks. Is it worth looking at different models of delivery for certain goods and services rather than just buy the same ones cheaper? And being respectful of our colleagues. As soon as I walk into a room, I'm quite aware a lot of the time that people think I'm just going to make them want to buy the cheapest thing, as opposed to the thing they actually need to deliver the best type of care. So engaging, providing options, becoming an influencing function rather than that functional, transactional, bureaucratic function. So next slide, please. So this time last year, a bit before that, last March, pandemic hit. So in 21 odd years of doing procurement in various different sectors, I'd never really understood how procurement became so important. The perception changed so quickly as it did last March. Everybody wanted to talk to procurement, and not because there was a potential problem, but actually because they realised that we were the partner they needed to help deliver the care where it needed to be. We had impacts where wards would go from being COVID-free wards to being COVID-red wards overnight, sometimes in as short as between 1 and 5 hours. People would email our team and say, we need PPE, we need ITU consumables to different parts of hospital with very short notice. Increasing the ITU capacity. St George's went at one point from just over 50 or 60 beds to 123. That had to be done in a very short space of time, which required procurement support for estates, and it required procurement support for our clinical colleagues as well. Switching to 24/7 logistics in partnership with colleagues helping us with supply PPE, we had to set 24/7 logistics up, so we had to be open, and that was done within a matter of hours. We had to support demand across all 5 sites, and then engage with the CCG and other partners across Southwest London to make sure that we could not only look after the acute trust we historically had, but actually we could provide the support to everybody when they needed it while supply routes were being created. We had regular meetings with primary care. We managed stock across the whole of Southwest London. We became involved in conversations that procurement never would have been before, not just about where stock was needed, but what it was and how we were using it. Procurement became the glue that held the operations side together in many ways. The collaborative attitudes, not just across Southwest London, but actually regionally across London, working with colleagues in other ICSs and other trusts that we historically wouldn't have engaged with as much. With NHS and we coordinated all the stock across London. We focused on equality of consumables and managing demand. We engaged with a single IPC team across Southwest London to make sure that where there were going to be changes in PP or changes in guidance, those and the implementation of those was actually done in partnership with procurement at the same time. The view of procurement ceased to really be cash saving. It was focused on getting the right quality product where it needed to be at the right time. Some of the behaviours where people are coming to procurement now to look at, well, what can we do? The value of setting up logistics services quite quickly, the value of engaging in things other than just CRP safety has made a huge difference to the way procurement is now viewed. When we launched the service in April, it was welcomed rather than viewed with some scepticism as it may have been previously. People want to engage with procurement. We've engaged with mental health services, community, and a much wider variation of people than we would have done previously. But the great thing is that that's been supported by NHS Supply Chain. Through an ICS, we're looking at ICS functional focus level. We had great support whenever there were stock issues, whenever we raised problems or particular challenges at each of the trusts during the pandemic. We could contact our colleagues at Supply Chain to help us out, and they'd always be able to give advice or at least point us in the direction of where we needed to go. The pandemic really has accelerated those behaviours and accelerated that cultural change of collaboration rather than competition. It's brought procurement a lot closer to clinical colleagues. It's had its challenges, particularly during supply throughout the pandemic, not only with ITU consumables, but across the board. We've had to maintain activity where we could in terms of St George's particularly being a trauma centre, and that element of work did not stop. So we still had to deliver. We still had to look to the future as well. We still needed to make sure that we had to set up a procurement shared service this year. And also look forwards, financial sustainability, because that doesn't go away. So actually, whilst we're trying to deliver the quality aspect of it, we've actually got to move forwards with the work plan. We have to move forwards with how we're going to deliver financial sustainability moving forwards. And those are the key behaviours that have come out. If anything, they've accelerated and removed some of the barriers that we may have had before because of the particular challenges faced. The key challenge for us moving forwards, both with colleagues at Supply Chain and in other trusts and ICSs across London, is how do we make those behaviours that were forced and that were required for us to carry on and be successful through that period, now to move on to when those pressures aren't there in the same way they were before. I'd like to hand over to Chris next.
Thank you, David. Hopefully you can all hear me. So I'm Chris Holmes. I'm the Director of Supply Chain for NHS Supply Chain. Firstly, I'd like to say thank you to NHS Providers for inviting me and inviting the rest of the panel. I'm going to talk to you about two things. I'm going to continue the theme, the ICU theme, from a COVID perspective in the response. And then I'm also going to move on to kind of the slightly longer term thinking around resilience. So what we're doing now and what we're going to start to look at for the future to start to share with you some of those plans. I'd like to start by saying, and I do this every time I get the opportunity to speak to people, is by saying a massive thank you to everybody within the NHS for everything that they've done over the past year. Our contribution is a small part, but those frontline workers have been incredible, and I personally am in awe of everything that's been achieved. So a huge thank you from me, and I know everybody from NHS Supply Chain. So ICU, and continuing that story, the demand around ICU products when the first wave of COVID hit and through that was unprecedented. I've got a couple of slides, so if we could move to the first slide, please. And these are not to try and kind of just bamboozle the screen with lots of numbers. They're just to try and show you the shape of the challenge. And to bring this into some context, this is in David's area, so the Southwest London Trust. And if you just look to the far right, what you can see there is you can see the peak as we go through the first wave of the pandemic. What that actually means in numbers terms is an increase of around 85% of the lines ordered across what we'll refer to as the ICU product basket that we were purchasing from where we would have been under normal circumstances. And also, as you can see in there for the eagle-eyed view, there are our normal peak periods of December in there. And as you can see, this peak, it just completely eclipses it. So when I talk about unprecedented demand, hopefully this can start to bring that into focus for you. I've got one more slide, so just move on to the next slide, please. So that was the picture in relation to Southwest London. But what you can see, this is the national picture. So whilst the peak wasn't as high, it was 63%, as you can see, it's still significant. So across the whole of the NHS, the requirement for ICU-related products increased exponentially and very, very, very quickly. If you just move to the next slide, please. So what I'm going to talk about is what we did and the people that we worked with to try and support the NHS to deliver that fantastic service that I spoke about. So it became very clear very quickly that there was going to need a significant and sustained response to the delivery of ICU products to help meet the demands of COVID and the changing demands of COVID. Because what I recognise, and I'm not a clinician, but the challenges that the clinical teams faced just in terms of keeping up with pace as I suppose the treatments to COVID became clearer, and being able to then look at that and translate that into what we needed to do from a product perspective was a really, really challenging time. But what this was organisations of Department of Health, NHS E&I, the NHS themselves, so there was significant support from the NHS and NHS Supply Chain, and in our broadest form, including our TAL partners, our logistics partners, coming together to work on this as a team. And what we're really trying to do was to use demand forecasting and say, where do we think the demand is going to take us to inform purchasing plans. Now, what you could see from those graphs was that the scale of the increase over such a short period of time meant that we had to do things differently. And what that did lead us to was being able to say, well, we are going to go and need to source products from areas where we might not have sourced them from before. So new suppliers, slightly different products. So the clinical requirement in that, because the absolute overriding aim was to make sure that what we had was products that were safe to use and that we could provide the guidance for clinicians to be able to use them in the environment, considering the extreme stress that these products would have been being used in. And that was a collective piece of work. And our element of that was then sourcing those products, getting them into our supply chain, building those stocks, because what we didn't know was what was going to come next. We didn't know how long the wave was going to last, whether it be a second, third, fourth wave. So it was about meeting the immediate need, but then also ensuring that we're equipped to continue to provide those same levels of service for an unknown period of time. And what we had to do working with those clinicians was really set out what the specification requirements were, and work that was born out of that activity will transcend itself into what we call essential specifications work, which will start to drive all of the activity within NHS supply chain going forward. So that's ensuring that exactly the requirements of the end user are factored into procurement activity, so that the outcomes and the products that are placed on contracts or frameworks therefore meet the needs of the NHS. What we also did as well to support the delivery of those products, because not only did the actual supply in terms of product flow come under stress, clearly at the outset of the pandemic, there were other products that were needed in a significant number. And there were also BAU products that were also spiked at the start of the pandemic as well. So we had to make some decisions about how we protected supply of ICU products. So what we did is we set up a separate supply channel. And that supply channel was set up with a separate logistics service provider managed by our prime logistics provider, Unipart, to ensure that we always had control over where product was going to. But the intent of that was to ensure that we could provide ICU products to our NHS customers at pace, and that not have to flow through a network that was also trying to provide all of the other products that our NHS customers also needed as well. So provide that dual type of resilience. And that was set up very, very quickly, and it's still in operation today, although to a lesser extent. And again, another learning point will be around how we ensure that in the future we have that capability to be able to scale up, turn on those types of activities really, really, really quickly. Another element that was critically important in all of that activity we did with the Department of Health and NHS E&I was the comms that then went out into the NHS. An incredibly challenging time, frightening time, and people needed to know what was happening and what we were doing to support. So it is areas that I'm sure we will get feedback on, and I'm sure it's areas that were not perfect. But what we did do is we did an awful lot of webinars. We put a lot of information on our website and tried to signpost people to read those when they could. And through both our customer services team and through our account management team, we sought to always be able to equip them with the most up-to-date information to provide that to our customers, and obviously wherever we could to provide that assurance and reassurance around the supply of product. So just to bring that to a close, it was a real team effort. There were lots of lessons that will be learnt out of that. To go back to David's point, I think there's lots of things that in that real hyper stressful situation led to agile decision making, and there are things that we need to absolutely cling on to as we come out of COVID and factor how they go into our business as usual working. There are also lessons that we will need to learn, and we're also looking at how we do that for any future activity that might come our way. Other than ICU, our demand, as I said, did spike across a number of different areas, and we were involved in other areas as well. So our home delivery service, which is a service where we deliver direct to patients, that saw significant increases in demand. We're talking around about just under 14,000 consignments per week and up to 10,000 patient deliveries per week that we were doing through that time. We also had additional new customers wish to come and get our services. And whilst we weren't able to do that in the initial outset of the first wave, from August onwards, we were able to start to add additional customers and support charities, GP surgeries, and other public sector organisations. And we added just under 350 additional organisations to our delivery portfolio between August and December 2020. We also supported the setup and the procurement of certain products for the Nightingales as well. And that was, again, another cross-government department piece of working with ourselves, NHS E&I and the Department of Health. And in all of that, what our aim was to do was to try and ensure that we maintained as high a service level as we could. And certainly in terms of those ICU products and our HDS, I mean, I'm very proud of the team, and I'm very pleased to say that the high levels of service that people come to expect from NHS Supply Chain, 99% plus, were maintained and continue to be maintained today. So I'm just going to talk a little bit now for a few minutes around resilience and moving forward. So I've spoken about kind of the lessons that we are looking at and what do we learn. And one of the first things that we're doing is looking at the levels of stock holding that we currently hold. And I refer to something, what I call intelligent resilience. So it's around looking at those areas, looking at the deep into those supply chains and where that product comes from, and saying, how do we ensure in the short term, because really it's about ensuring we shore up supply, even outside of COVID waves. We know that COVID will impact supply chains for some time to come. So we need to make sure at this moment that we've got plenty of stock on hand. So our initial strategy is to ensure that we increase, and we have already increased, many of our products from a stock holding of around about 3.5 weeks, which is where we've operated for many, many years, towards 6 to 8 weeks. And in some areas, it's substantially higher than that. And that is to ensure that as we come out of COVID, and then we move back to the startup of elective procedures, what we don't see is then service issues. It will also support us as well in the event that there are further COVID waves. And the ICU activity that I spoke about earlier features very much in that. So we are continuing to develop and replenish the stockpile of ICU products, even though the actual cases and the demand is actually on the wane. What we're also doing, and we had started this activity prior to COVID, but I think it's important for you to kind of, again, recognise the investment that's going in and the continued commitment, is we're looking at the capacity within our logistics network. So in May 2020, so when the first wave was in full flow, we did open a new distribution centre in Bury St Edmunds. The original plan for that distribution centre was to replace the one that was originally there, but it was going to be state of the art, twice the size. We changed those plans as we went through COVID and kept both of those sites open so that we could dual run and provide, again, additional capacity and resilience if needed. We've subsequently closed the old site, and the new site is now fully operational and multi-award winning, but maybe we'll talk about that another time. But very successful project that's been delivered, and that's delivering now significant volumes of product into kind of the North London and those home counties areas. What we're also doing as well as part of our infrastructure strategy is we're going to invest further in increasing that capacity, which will also increase the capability. So over the course of the next 3 to 4 years, we will add incrementally up to 1 million square feet of warehousing space, possibly slightly higher than that. Now, for any of you particular logisticians, that's quite a lot of warehouse space, and it will enable us to firstly grow, which has always been one of the aims of NHS Supply Chain, which is to enable our customers to benefit from that aggregator service by us being able to increase our capacity. But it will also provide us with that additional resilience, that additional resilience to enable us to store more products when we need to and operate in different ways when we need to, and also to expand upon services as we move out of COVID and start to support BAU agendas such as the move to ICSs. We also are going to continue to the investment in our systems. So many of you will be aware, will have heard previously about core technology changes that we're doing, but we'll also be looking at those systems that have been developed as a result of COVID. Demand management is something I've spoken about already, and that's an area whereby we need to build on and be able to actually improve from where we were, and that's across the NHS, not just actually from an NHS supply chain perspective. So that's everything from me. So a big thank you, and I'm going to hand over now to Sara.
Great, thank you, Chris. So could we go to the next slide now, please? That's it, great, thank you. So we thought we'd finish this little section by talking a bit about our priorities for the coming year. So as for many organisations, we have evolved our business plan as a consequence of COVID. And I think what we wanted to do was make sure that we try to do what David's talking about, which is actually try and capture and sustain some of the change ways of working in the priorities in the business going forwards. Now we're sort of out of the heat of the battle, but still there's a lot going on. So you'll see there are 5 priorities that we have as a business. Down the right hand side of the slide, you'll see our values as an organisation, and we believe those are really important to helping deliver our priorities. So the obvious first one to talk about is the focus on the customer. We're talking about actually anchoring. Sorry, I can't reach my phone. You just have to it will stop ringing in a second. We'll talk about anchoring our business on the needs of customers. And I think in the past, we've had feedback that actually we haven't always done that as successfully as we might. And this is absolutely front and centre for everything we're trying to do this financial year. So obviously, acceleration towards collaborative working, as David's very eloquently articulated, is a priority for us as well. How do we support groups like David's in being able to do what they want to do, whether that is helping to streamline and simplify how the procurement teams operate, or how we can support with dialogues with clinicians around clinical change and switching. Obviously, David referenced the fact that we've restructured teams and things to be able to support those dialogues within the trust. So that's our first and foremost priority. The second priority, I think Chris has done a great job of explaining around resilience. This clearly is absolutely a priority for us this year, but I won't build on anything that Chris has already articulated. The third priority we have around safety. So we spoke a little bit at the very beginning of the session around the importance of safe and assured products that we deliver into the NHS. Chris mentioned the essential specifications process, which builds on our prior levels of assurance and builds in human factors and human considerations that will be baked into the way that we go to market and procure our products. But more than that, we've got a process we call Siren, which is really our post-procurement monitoring process to help wherever there are issues identified across the system relating to products, that we're agile, we're quick to understand what they are, and we're quick to push information out in the most helpful way possible and address those issues. And then a new sort of corporate strategic priority, not because we weren't working on it, but I think we felt actually it needed raising up to that level within our organisation around sustainability. So obviously, as a national supply chain, we've had a number of projects on the go for many years around delivering sustainability, but in line with the NHS's ambition to become net zero by 2045, we see ourselves as a leading part or a material part of helping the NHS to deliver that. And that can either be around delivering net zero, but also aspects of that around social value and ethical supply chains. And what we want to be able to do for the supply chains that we manage is actually make these changes once and on behalf of the whole NHS. So just as an example of something we've very recently done, we are engaging with a number of suppliers to get them to complete a tool called NQC, which is a government recognised portal, and they have modules in there around modern day slavery and labour standards. And what we would like to happen is that the suppliers complete those assessments once into the tool, and we've negotiated with the tool provider that all trusts will get access to that same information. So rather than duplicating effort or having the trusts with the burden of gathering that data, we gather it once, we enable access to all, and then hopefully that benefits both trusts and suppliers. But we're actually publishing a number of targets within the sustainability area this year, so look out for more details on that. That's a big focus for us. And then the final area, just to touch upon efficiency. Obviously, huge financial burden across the entire system. That's only going to get more acute in the coming months. So we've a number of targeted activities there, not only to help obviously drive savings out to the front line, but also in the way that we operate and how we make sure that we're playing our role in being the most efficient organisation we can be. So hopefully that helps sort of bring things together and paint a picture of how we're trying to capture some of the changes that have happened over the course of COVID and bake that into our future business model. And obviously importance of good communication and strong governance, really key in making that happen. Obviously you've heard from Southwest London and how they've built trust and confidence in their structure and how that will benefit into the future. We believe that if we can deliver against these priorities, then hopefully we'll be in a really good place to move with the system as it goes forward to deliver on the various objectives that exist. So I think that was all the content and the the information we wanted to share, but we would very much welcome questions. And if I hand over to yourself now, Kevin, just to go through the 2 polls, and then that will hopefully give people time to reflect and add in a few more questions. Thank you.
Thank you. And I think we can take the slides down now as well so we can see the panel. Great. Thank you. So we've got the first polling question. I didn't realize we're going to do it on the slides here, so that's fine. So I'll just read it so people understand, and then we'll flip quickly to the poll. How far would you agree that in your organization you've seen long-term benefits to systems and ways of working? Quite a broad question, but changes to systems and ways of working as a result of the changes that you've implemented in response to COVID. We'll just give a few seconds for people to vote. Okay, so most people saying, yep, there have been some changes, and a few interestingly saying, yep, we haven't seen many changes, but mostly saying there has been change. The second question has been answered too. I didn't realize that was going to come up. It looks like, where does NHS Supply Chain where do you believe you get the greatest value from NHS Supply Chain from? People emphasizing savings. I was struck in the conversation that it wasn't just savings, there were other ones, and we'll come on to that in the panel questions. And also that you're a resilient supply chain, and we certainly heard a lot about how you're building even further resilience into the system. So thank you. We're going to turn to Q&A now. Please do, the audience, please do keep questions coming in. I am going to start with Geeta's. I've got a few questions as well that I have prepared if you know we don't get too many more from the audience, but I'm going to start with Geeta's and just ask you a little bit more about, could you unpack, you mentioned the questions that you're asking your supply chain, NQC, I think you talked about. To what extent does that cover diversity, and what else can you and do you plan to do to cover diversity and equality within the supply chain to try and improve how employers and suppliers working in that context?
Should I start? So what NQC will allow us to do is to build on some of the things that we already do, which are around ethical trading, labour standards, ensuring that that we are understanding of child labour and how those things might affect supply chains. So the intent is to be able to unpack the detail around where our products or elements of products coming from and have greater levels of information to then allow you to make more insightful decisions. Because that is always the challenge when you operate in the global markets that we do. You can place an order with a supplier, but who's the supplier placing the order on, where the raw material is coming from? So that's the intent of the work that we're going to do and the tool that the NQC will support us with. So it will build upon activity that has been in place, but it will allow us to go in slightly different directions and deeper.
Fantastic. And does it look at kind of because these are multinational companies that you're dealing with presumably as well as where they source their things from and how they manufacture, does it look at the actual employment within the company itself as well?
I don't think it goes as deep as that, other than, as I say, particularly around child labour, in terms of making statements around that, but not specifically around, if you were an organisation, what your employment terms and conditions might be. It doesn't go as deep as that, no. Or
the sort of the nature of how diversity is championed within that organisation. Yeah. So more to do, I think. And interestingly, I remember picking up in the annual conference that we had in October, where that was also something saying, that question was asked, and you said you were going to be looking at that further. So I think we look forward to hearing a bit more depth on that one too, if I can sort of speak for the audience here. I've got a building question on that one, if I can, which is to talk about you talked briefly about the carbon agenda and how you're moving in that direction. How significant a dent on that can you make for our trust members, and to what extent should they be coming to you saying, can you help here?
Well, I think the way that we can help is clearly we're looking to have a consolidated supply chain. So if you buy most of your products from NHS Supply Chain, then you will reduce the number of vehicles that are on the road. So that is a very simplistic way of looking at it. So do we think we can make a contribution? Clearly we do, and we will have our own targets, and most of those targets will then obviously be supporting the NHS, because if we are able to improve our own position, then we'll be helping to improve the NHS's as well. So I think we can make a material difference there. The targets, the overall targets are very, very high, and NHS Supply Chain can't do it alone, but it is a starting point. I would suggest that the NHS does look at, obviously at the moment, but I would imagine we'll look at even further, just from our own perspectives as well, because what we're clearly, if we have more product flowing through our networks, we may need to put more vehicles on the road and so on and so forth. What we are doing whenever we're looking at our vehicles, and we're looking at that now, we're looking at the options to make sure that what we've got is the most efficient vehicles that we can have, including looking at how we might incorporate in the future, because the technology is not there at the moment for heavy goods vehicles, electric vehicles as well. And in our sites, we're also looking at our sites and how they can contribute to a net carbon position also.
Great. Anything else from the other panel on that point about environment to add? I've got a follow-on question if we're happy to move on.
I was just going to add that we're working very closely with NHS E&I in terms of the strategy, so Dr. Nick Watts and that sort of thing. So I think our objectives and aims and targets and that sort of thing are very tightly aligned. So I would expect more information to flow as time progresses, but I think we need to come at it in terms of what we have within our control, and clearly that drives our targets, but obviously what we're trying to do is support the NHS at large.
Fantastic, thank you. I've got a question for David, if I can. David, could you just unpack a little bit? I'm very interested, because the audience here is going to be a mixture of trust people, basically, governors and trust leaders. So I'm interested in your perspective about how did you work with NHS Supply Chain? What kind of how was the relationship built and developed over the work that you outlined there? Clearly an amazing shift in how you tackle procurement in your area. I just want to get a little bit more about the interface. And then if I can ask a related question to that, just as for you to build on, what advice, what kind of questions, what assurance questions would you give to board members listening now? What questions should they ask to say, are we using NHS Supply Chain in the right way? I'll ask the wider panel that question too, but just ask you first, David. You're on mute.
So in terms of the first part of the question, Kevin, I guess how it's involved. So going back sort of a while, and a meeting I probably had with Adam quite early on in terms of the engagement in Southwest London that wasn't really there. So there was a big change in engagement, and the conversation we had around getting St George's involved, because historically, being honest, we weren't as much. And then it became actually, how do we make the most of our partners? So one of the things we've always talked about at Southwestern is how do we make the most of our partners? We've got the London Procurement Partnership, we've got supply chain, we've got all of these commercial services, we've got all of these partners who could add value and to help us deliver. I think we're quite conscious that we couldn't deliver things on our own. We couldn't do it just with the teams we had. The ask was big. So in terms of developing the relationship, started off fairly small, understanding the issues and why the engagement failed in the past in terms of, I guess, from supply chain's point of view, leaving things slightly and sort of handing over, we've done this for you, off you go, to a much more partnership delivery approach. So actually having the tracker, creating ways of working documents between the organisations to make sure that we all understood our roles and responsibilities. And then the engagement grew. So the restructure that Sara and Chris mentioned was around the team looking at us as an ICS, looking at us as a group of organisations rather than picking us off individually, which is important, especially when you have organisations that are quite varying in size. So it's one approach that went across all the four trusts, which was great. I think from then, the relationship was just developed. So our first port of call with everything was our attitudes towards supply chain. So Chris's point of putting as much through one place as possible to streamline what you need to do was actually, if we could better or beat something, we would go with supply chain. It made sense. It was, we see it as part of our organisations rather than a supplier or partner, but they are part of our teams. And I think it's then driving to what can we do next. And I think that through COVID and the engagement we had, the relationships we built really helped us to develop. And I think now moving forward with the green agenda and sustainability, we're starting to look at things differently, not just savings, looking at reducing waste impacts and taking out what you throw away, looking at things differently and defining value in a different way. And I think that's really helped that partnership between supply chain and Southwest London. In terms of the second bit of the question, which I think was around assurance of what questions should we be asking of how we
what
engage.
questions should a board ask exactly? Because it's helping the audience make sure they're asking the searching questions to get the engagement right.
So I think there is a value element of what it is exactly you want from supply chain. I think it goes down to the core principles. If it's just a savings mechanism, I mean, because supply chain, let's be honest, supply chain's first role, as far as we can say, is to get the right stuff to the right place when it's needed. That's procurement and supply chain's main aim. The bit that goes over the top of that is the savings and the value delivery. If that's all you want from them, then the question should be about how you're maximising the sharing of data. What are we sharing with supply chain? How are we engaging? How are we creating opportunities? Are we providing things, or are we just waiting for things to come to us? I think it's quite an important conversation to have. I think it's important for certainly for boards to look at how the individual trusts are engaging or the organisations are engaging. It's not just about how you're being engaged with, it's about how you approach partners at the same time. And then I think it's about what else. So the sustainability, the value, the other elements. What else are we going to get from it that's not cash? And that comes to fundamental change, not only in procurement, but how then you view partners like supply chain at the same time.
Thank you. Really nice, tight answers, David. Thank you. I want to put the same question to the other panelists. Adam, I don't know if we've heard from you yet. I wonder if you want to kick us off from the other members of the panel. How would you coach or advise a board to ask questions that get the best out of NHS supply chain?
I think from my perspective, understanding about the performance stats, perhaps not at board level, but certainly at a senior level, director of procurement, potentially director of finance level, we seek to have engagement and periodic face-to-face engagement to go through progress and statistics. But if I may, to add to what David's just raised, and the answer he's just given from my perspective, leading it from an SCCL NHS supply chain perspective, I think it centres around, in terms of strong engagement and how it can be replicated, I think it centres around two areas. That's around governance, ensuring that we have a governance structure so that we have routes of escalation within both organisations to ensure that there is transparency and visibility of exactly what's going on, rather than individual key nominal stats that may come out periodically through the year. It's having that regular engagement. And secondly, around engagement. So we expect to have multi-layered, and where it works well, and again, this should filter up to board level. We have multi-layer engagement throughout a trust, ranging all the way down from the materials management leads, clinicians. We work with procurement, finance, right up to board level. And I think those multi-layered relationships, that's really what's key for us to get a joint understanding of how the respective organizations work, and to ensure that we flex the approach that we deploy to maximize the benefits driven.
Thank you very much. Anything from Sara or Chris?
I'm not going to repeat. I fully agree with what's been said, so I won't rather repeat that.
Yeah. Okay. Then I'll just ask a final question. Just to sort of bring us a little bit back to the kind of COVID pandemic piece. And one of the interesting bits, certainly from where we were sitting, was the sort of wrestling of PPE to the ground in different ways. And it's moving back to you now. Of course, they centralized it and did a sort of command and control structure, but they're moving it back to you. Could you just update us on the kind of, where are we in that process of moving it back to you? When is it fully back with you? And just any assurances that you think our audience might want to hear in that context. You've already given a lot about how you're looking at building resilience and, the lessons learned and how much stock we need to hold and all that kind of stuff. But just wanted to come back around that. And then unless there's any other questions from the floor or things that you want to say, we'll wrap.
Okay. Shall I start? So start last year. So the decision to operate a separate PPE operation, physical operation, was similar to where I spoke about the work that was done on ICU. It's around ensuring that what we got was greater levels of resilience, and we had a supply chain that could specifically focus on the very, very, very high levels, and I don't think anybody could or would have ever predicted the level of demand for PPE as a result of COVID, even at the outset. So that was put in place at pace. That was put in place with NHS Supply Chain. So we were fully on board with that. We actually helped set that up. Then obviously we got back on doing what we were being asked to do, which was our day job, and obviously also the ICU once it was set up. So that's great, and it's worked and it's been successful in support of the NHS. The view was that it was always going to come back together. And that activity is underway. The stage we're at the moment is in that planning phase. So what I suppose is really, really important for colleagues to understand is that what there isn't is a kind of desire to bring these together at such a pace that actually will impact or potentially impact service. So we have a model that continues to deliver out. Some of the people on this call may already know there's already products that have moved across that were originally in the PP element back into NHS Supply Chain. So that's been in place for some time, and that will continue to happen. But what will happen also more is that the PP style in terms of the way that that's operated and the governance around that will become one. So that will be the first phase of it. The physical nature of how those operations change will be worked through, and that will change over time. But as I say, the very, very clear position from everybody involved is we have to maintain service. And whilst we know directionally things are looking, notwithstanding Indian variants, but things are looking quite good at the moment, people are already starting to think about, well, actually, we need to be prepared in case in the winter months there is a further wave and a further spike. So anything that is done, and I'm not being deliberately elusive, but the planning phase is what we're in at the moment, but whatever is done will be done with a view to ensure that the continuity of supply continues and risk won't be put into that through this transition process.
Fantastic, thank you. Really clear. Very helpful too, I think, certainly from our audience's perspective, about just understanding that the continuity is paramount. I'm sure it would be, and I'd like to thank you. I know you thanked our members for all that they're doing. You're helping keep the lights on too, so thank you for all you're doing too. We're proud to be a partner with you on this conference and beyond. I'd like to thank our audience for listening, and I hope you found it useful. There will be opportunities to ask NHS Supply Chain further questions. We've got a relationship that goes on beyond this conference, so please do keep listening and engaging with NHS Supply Chain through your own offices, but also through us. We look forward to working with you in the future too. If there are any other final points from the panel, I'll give you the final floor and let you close.
Only for me to say thank you to NHS Providers, thank you for the NHS for allowing us to come and talk today.
Great, we'll finish there. Thanks.